It's a pleasure to be here, and as Georgina has already mentioned, it has been a very exciting time in melanoma the last 2 years. In 2011, 2 new drugs were approved, the first drugs ever to show improved survival, and the pace of development has really been breathtaking. I'm here to talk similarly to what Georgina mentioned about combination BRAF and MEK inhibitors. As you can see on the slide to the left, the pathway is one of the prime mechanisms of resistance is reactivation of the pathway, making MEK a good target to try to overcome that resistance. As you can see on the first graph there on the graph, that both drugs, the BRAF and the MEK inhibitor, work alone, but when combined, they really produce synergistic results. As you can see in this portion of the slide, this patient was progressing on BRAF inhibitor. You can see this highlighted area there, the extensive tumor in the abdomen and in the pelvis. The prognosis for this patient was probably extremely poor. And in just 14 days after the addition of the MEK inhibitor to the RAF inhibitor, the response is really dramatic. This is the study, the BRIM-7 study, combining Vemurafenib, a BRAF inhibitor, and GDC 0973, the MEK inhibitor. And this shows the 10 cohorts that were done in the study, looking at escalating doses of the MEK inhibitor and lower doses, 720 of the BRAF inhibitor, and then the standard dose of 960. So this way the doses of the MEK inhibitor increase. And here the variable was really looking at the change in the schedule from a 21 days on dose to 7 days off to continuous dosing, again with 2 different doses of the MEK inhibitor. The toxicities encountered in the study, many of the patients, 95% of them had some number of adverse events. About 30% ended up having serious adverse events. By that we mean grade 3 or 4. And you can see that most commonly these consisted of rash, diarrhea, photosensitivity or sunburn, fatigue, and nausea. Attributable to the drugs also were specific side effects to the MEK inhibitor, chorioretinopathy, and in particular, I'll call your attention to squamous cell carcinoma, as this is a side effect of the BRAF inhibitor. And as in the prior study, the frequency of this was significantly decreased. We had only 1 case among all of the patients who developed the squamous cell carcinoma. And mechanistically, it's been defined. The 1 patient who did experience this, in fact, had a very low level of the MEK drug. And again, the responses, this is in the previously BRAF untreated group. And you can see we start out at the baseline of 0, and virtually every patient showed some evidence of tumor regression. This is an early study, less follow-up than the previous one, but it's very encouraging to see such a high response rate and essentially confirming what Georgina has already presented. That's what I had, so thank you very much.
Thank you all.